like to thank you for taking this time to meet with me today. My questions for you today is, what is your experience in this field?
I have been a nurse for 25 years. Most of it has been in critical care. And currently I'm an advanced practice nurse at Jewish Hospital, and I'm also the project manager for the development of our liver center for the Mercy Health system. And so patients requiring assistance and help with liver disease up to the point of transplant, we take care of them on a regional level from all the other Mercies.
Being a professional in the related field, what is your ethical viewpoint on the subject?
The marketing and selling of organs is totally unethical, and I'm just blown away even by the thought of it. I think it can lead down to many roads of black market and possibly even murder, as people who are very ambitious to gain money would even murder individuals to try to find a good kidney or a good heart for transplant. And it could even end up being something like a puppy farm, where we have human farms where children and babies are born and raised just for the purpose of their organs.
What do the statistics show of people in need of receiving or selling of human organs?
I don't know the actual numbers of the statistics, but I do know that there's a lot of individuals who die waiting on the transplant list currently for a donation of an organ. So there is a great need for organ donation, but marketing and selling of organs is not the answer.
What would be the breakdown of the market?
That's really hard. I can't even fathom what something would look like. You would need a government agency to oversee it, to screen the organs for disease such as HIV and hepatitis, the storage of the organs, and then would you be taxed for selling an organ? So it's just so hard to believe. I really don't know what that would look like, but I do know that it would not. It's definitely not the answer.
How would donors be selected if it were, in fact, to be legalized?
Again, that's another part of the big ethical debate. You could probably more likely would be from lower income populations that would donate their organs in order to obtain money for survival, or possibly even to support one of their kids through college or something, whatever would be the motivator for them. And again, lead to something such as the black market, where they take a hit out on a person that they know that is healthy, for someone who is very rich and has a lot of money to buy that person's healthy heart or organ. And again, could it possibly lead to something like the human farming of children just to obtain those organs?
Who would be in charge of overseeing who receives which organs?
I don't know. I mean, possibly insurance agencies. But, in healthcare, we are committed to do no harm. And the marketing and selling of organs, I think, would be more harmful to the healthcare industry and to our overall nation, as a nation's population's health, than it would be beneficial.
Would the quality make a significant change in price of recipient?
Oh, probably so. If you could get a healthy kidney from a teenage age person that has no disease or anything of that manner and is 100% working, and as you get older, your kidney function automatically starts to decline. So even from a 50-year-old who is healthy, a person would probably more likely would want that teenage kidney versus someone who's 50 years old.
Do you think the legalization of human organs would be beneficial?
No, absolutely not. I think it would just open up a lot of pathways that we don't want to go down to. And then if you get, like I stated earlier, individuals who are ambitious to make to get rich actually off of the loss of someone else, I think it would lead to less stringent screening of the organs for cancers or diseases and such.
The sale of bone marrow has been legalized. What is your opinion on that compared to other organs?
Well, like bone marrow, the donor is not affected, their quality of life is not affected. They're able to continue doing their job, their work, their home, their family, and the bone marrow is regenerated. Whereas compared to other organs, your quality of life could be greatly affected. Possibly not so much with a kidney, if you donate one kidney, but if your other kidney happens to start failing on you, then you're looking at dialysis. That's the only other option, or a kidney transplant for yourself. That's one of the biggest things I see that's different, is that the bone marrow donor is there's nothing it doesn't affect the outcomes on the donor or the recipient, except the recipient hopefully will get better and heal from the donor.
Well, since bone marrow is considered a human organ, how does that differ than, say, the sale of liver?
Oh, it's a huge difference. Most working quite significantly with a lot of liver patients who are requiring a liver transplant, also oftentimes than not require a kidney transplant as well, because it has lead to kidney failure. So now you have like I said earlier, the bone marrow transplant doesn't affect the donor's quality of life at all. However, the donor for the kidney and liver, oftentimes we get those currently at death, and then could possibly lead to murder, or people selling children or individuals just in order to obtain organs for someone else that has a significant amount of money. And just talking about livers of itself, how many times could a person have a liver transplant? Is that something that would be looked at too? If you're someone who has an unhealthy lifestyle of that leads to fatty liver disease from eating high amount of sugar, fat content, to alcohol disease, or obtaining hepatitis from having risky behaviors, are you going to continue to have how many liver transplants until you just run out? I don't know.
Thank you very much for your answers today. You've been very helpful.
Thanks
again.
Good luck.